Hi friends, I'm Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about itching during pregnancy. As such, itching is quite common. See, in the initial weeks it could be because of allergens or some dust allergy or some food allergy might be the reason. But it's more commonest in the third trimester of pregnancy, that we call it as cholestasis in pregnancy. And how do you identify? The lady usually develop intense itching, and especially it's more common in the evenings and in the night times. And they'll have severe pruritus and which can lead to scab formation as well. And then how do you identify? See, usually the lady will have symptoms of severe itching. At the same time, there will be yellowish discoloration of the skin, urine, as well as eyes. As the sclera of the eyes, they get yellowish discoloration. So that's when you need to consult a doctor immediately. And we usually check for liver function test. So in liver function test, the bile pigments and the bile salts will be elevated, and of course the liver enzymes also will be elevated. And in this group of patients, usually the coagulation profile like PT, APTT and even INR will be elevated. So these are all the candidates who belong to a high risk pregnancy. So as such, you need to know why itching happens and what's the mechanism behind that. See, usually in a normal individuals, for everybody, the bile hormone will be secreted from the liver, and this bile pigments and bile hormone, it is very much essential for the food digestion and for the fat digestion. So once it gets secreted from the liver, it directly goes to the gallbladder and we are all safe. But in pregnancy, what happens? Because of increased pregnancy hormones, increased estrogen and progesterone, this bile hormone, instead of going to the gallbladder, it gets accumulated in the liver only, and from the liver it gets circulated in the bloodstream. That's when the lady starts complaining of itching, and that's how we usually identify with the investigations. So what are the complications the mother and the child faces? See, in the mother, what happens? Because of altered coagulation profile, the chances of excessive bleeding during pregnancy, chances of landing in postpartum hemorrhage, and chances of landing in hysterectomy will be more. And at the same time, for the baby, there are again chances of fetal distress, meconium aspiration syndrome, and chances of respiratory distress, and the chance of sudden intrauterine fetal death. These are all the known complications with cholestasis in pregnancy. So we know the known risk factors. So that's why you need to consult doctor immediately. And of course, at the time of delivery, we keep all the precautions ready to prevent a postpartum hemorrhage. So we keep the uterotonics ready, and we keep all the necessary things which to anticipate the whatever the complications are anticipated, we keep everything ready for that. At the same time, immediately after the baby is born, for the baby we give injection vitamin K to prevent bleeding from the umbilical cord. So these are all the known complications for the mother and the fetus. And nothing to worry. So if at all, if you have any itching during pregnancy, please consult your doctor immediately, so that we can avoid further complications, and we can take adequate precautions and how to prevent, and what are the precautions you need to take in the diet. That also your doctor will be explaining. See, basically whoever have this jaundice levels or the bilirubin levels more than 5, it is significant in pregnancy. Those individuals we advise to avoid non-veg and avoid carbohydrates and redefined redefined carbohydrates also you need to avoid fats as much as possible. You need to take high fiber diet, take more of fluids, adequate hydration, and you need to avoid constipation in this type of patients. So friends, if you find the video is nice, if you find it's informative, please like my video and share with your friends and needy people. Thank you.